Hi, I'm Dr. Sham, and this video is going to be about the postmortem or the autopsy. So, as you know, that postmortem is carried out to find out the cause of the death. Um, it's carried out when the death is suspicious, or either sudden or it's unnatural. So, carry out the postmortem, and the aim is to determine the cause of death. So, the next thing is that who could request actually the postmortem? So there are the three persons who could request the postmortem. The first one is the coroner. The coroner is actually a doctor or a judicial officer, okay, a lawyer, responsible for investigating the deaths. Okay, can anybody, like any doctor, could be a coroner? No, at least he should be having a 5 year experience, okay, to appoint himself as a coroner. The next one is doctor. So doctor could also request, a senior doctor could also request um, postmortem to find out the cause of death, because that's going to be beneficial for the rest of the patients, okay, and for further medical research. And the third one, the last, is partner or a close relative, okay, blood relations. They can also request the postmortem to find out the cause of the death. Now the thing is that what are the steps involved? Okay, so if we talk about the steps, the first one is, okay, you need to remember the two things. Okay, there are two consents in a postmortem, okay, and there are two examinations, okay, and this is what you will be explaining, okay, to the person actually who is requesting, either a partner or close relative. Okay, the two consents are, one is the consent for the procedure. Okay, even if the spouse or a relative, close relative, is requesting postmortem, you have to take a formal consent, okay, written consent for that. So you take two consents. The first consent is, that is for the procedure, and the second consent is to remove any of the organs if needed, okay, any of the organs if needed. So these are the two consents. And always ask about the sport, okay. Normally you give the 24 hours to the spouse or the relatives who is requesting the postmortem to think think over that, and they can take the sport, okay, of anyone close to them, and they can change their decision, okay. So you need to do that, okay. Two consents, then two examinations, okay. One is external examination, where you do the general physical, that is a physical examination, plus, yes, you do the CT and the MRIs for the radiological evidences, okay. And the second examination is internal examination, where you open the body and you remove the organs as well if needed, and you send them in histopathology, okay. So how are you going to do the things? You take the consent for the procedure, and take the consent to remove any of the body organs if required. The next is examination. Two steps in the examination. External examination, which involves a physical as well as taking the radiographs, and the internal examination, where you open the body and remove the organs and send them lab for the histopathology. But then what you're going to do, you stitch back the organs if they are not needed for the long. Okay, you stitch back and you stitch the body. Okay, and you put the body in a box, close the body in a box. Okay, and you then hand over to this partner or the relatives, close relatives. Okay, so this is how the postmortem is actually. These are the steps. Okay, now there could be different questions related to the postmortem. The first could be like, how much long it's gonna take, okay, or when you're gonna do the postmortem. So it is normally carried out in 2 to 3 working days after the death, okay, but could be as early as in 24 hours, okay. It takes a couple of hours. The second thing, it takes a couple of hours to do a postmortem, but the final results, okay, that could take a couple of days, because it's going to take a few days to complete all the essential paperwork and the documents, okay. So if somebody is asking you about that, you can address the concern like that. Then okay, will the body be disfigured? No. normally the organs are put back, okay, if the cause of death is determined. But in some cases, for the research or for if the cause of death is not determined, you need to keep them for long, okay. But if not, then you're gonna put them back and you're gonna stitch the body nicely, okay, as neat as you can, okay, and then you put the body in a box. So okay, so if the body is in a box, nobody can notice those what you have done, okay. Okay, so what's next? If you have to deal with a case, any of them. So if somebody is requesting, I suppose, or a partner or a close relative. So first of all, that ask about the concerns. Okay, what are the concerns? Okay, so he or she's going to tell you about, okay, that she's interested in that thing, in the postmortem. Okay, then express your empathy. Okay, that is the most important thing to do over here. And then you need to ask that, okay, what he or she knows already about the postmortem, okay, and then you add on a little bit information into that, okay, explain, okay, a little bit, and explain in this way, like, okay, we need to take the consents, okay, and then we do the exam, okay, 2 steps in the exam, internal exam, and we remove the organ sometime, okay, that's after the exam, informed consent, and then we put back and we stitch nicely, put in the box, and then we hand over to our, we offer the funeral services as well. So this is as far as the postmortem is concerned. So pretty easy. Hopefully that's going to help. Thank you so very much.